In the fall, a policy enforcing mandatory vaccinations for Niagara Health staff was announced. With hospitals facing a shortage of staff under Omicron, that policy is being relaxed to deal with current healthcare demands. We're joined by Chief of Staff Dr. Johan Viljoen. Doctor, was this a difficult decision to make?
Omicron has really forced us into the position where we are making a number of difficult decisions. So yes, this is a difficult decision to make. We still are very committed to make our acute care environment as safe as possible for our staff and for our patients that come into the environment for care. So for that reason, continuing to strive for a full vaccination of all staff is still very much on our radar.
Dr. Viljoen, how long do you expect the pause of the mandatory vaccination policy to last?
We have to be agile and mindful that no matter what the circumstances are, we have to continue providing care. For us to continue providing care, we have to have the most healthy staff, in our facilities that we can. The uncertainty around Omicron and the ever-increasing numbers does put pressure on us. So under such circumstances, one has to be reasonable. Putting a timeline on it is impossible at this point. We don't really know whether Omicron has peaked. We don't know how many weeks, and I sincerely hope it's weeks, this may be continuing. And for that reason, I think one needs to be open-minded around everything we're doing.
At this point, what is it like in the ICUs and the acute care areas of Niagara Health hospitals? Are we overextending ourselves?
We are holding our own. There's no doubt about that. Very confident to be able to say that. However, we are working at full tilt. There's no doubt about that. The pressure is high in the ICU. You may have seen that we, over the past weekend, had to send 2 patients to London Health Sciences just to help with some load leveling. We are very thankful that we are, as a regional group of hospitals, we are well connected, we are extremely supportive, and we do load sharing where it makes sense. So on a day-by-day basis, we are really very much in control of our operations. Of course, you can see the daily case numbers going up. The admissions are certainly going up as well. So there is a lot of pressure on the system, but we are holding our own.
What are you doing to make sure that the unvaccinated staff members are safe as they head into the hospitals?
So at the moment, if unvaccinated staff members are heading in, they are doing rapid antigen testing on a regular basis to ensure that everybody who is involved, safety is still protected.
Dr. Viljoen, obviously Omicron is what caused the pause of the mandatory vaccination policy. We're now dealing with a new variant that is originating out of France. Will this force us to extend that pause even further?
I think it's important that we focus on what we're dealing with right now. The evidence so far, as reported by the World Health Organization, is that this variant has not been shown to be a problem quite yet. So for the moment, it's keep our heads down, deal with Omicron as best we can.
Dr. Viljoen, thank you very much for sharing your expertise with us today.
You're so very welcome, and have a good day.